reading a question, so you have to pick up the key points of that questions. What are the key points of this question?
Dyspepsia, vomiting,
First,
anorexia.
the age. The patient is 50 years of age, male patient, okay? Then, dyspepsia.
Sir, occasional vomiting.
Okay.
Then, sir, anorexia and weight loss. And, sir, on examination, he has anemia.
From the history, you have got the age, the complaints of the patient, that is dyspepsia, occasional vomiting, and anorexia, weight loss. What is the initial pictures of your diagnosis for this patient?
Sir, carcinoma of stomach.
This is a carcinoma. This is a carcinoma or malignant condition, not a benign one, is it?
Yes, sir.
Okay. Then on examination, you have found
anemia and epigastric mass.
Okay. So dyspepsia is usually occurs in the carcinoma stomach, okay? And dysphagia, that is difficulty in deglutition, that usually occurs in carcinoma esophagus. So from the question, you have to also diagnose the carcinoma is present in the stomach. Okay?
Yes, sir.
Now you can say that there is an epigastric mass. So the malignant condition is arising from the stomach, from body or pyloric end. Okay? That is antral carcinoma. So when you say, what is your diagnosis? You said this is a carcinoma stomach. What investigation you want to do now?
Sir, upper GI endoscopy with biopsy.
Upper GI endoscopy?
With biopsy.
With or without biopsy? If the lesion is present, then you can take biopsy. If there is no lesion, how can you do the biopsy? Okay. So you have to say, as there is an obvious mass, so you can say, I want to do a biopsy from the lesion. But if the question not having or not saying that there is any mass, so that time you have to say with or without biopsy. Okay?
Yes, sir.
Now, what are the signs of inoperability in this case? Signs of inoperability means?
স্যার এখানে কি ইনভেস্টিগেশন কনফার্মেশনের জন্য একটাই বলবো?
একটা হচ্ছে confirmatory investigation or diagnostic investigation. Question was, name one investigation to confirm your diagnosis. So you have to say only one investigation. That is upper GI endoscopy of stomach or duodenum with or without biopsy. But if you asked what are the investigations you want to do, then you have to start with blood, that is complete blood count with ESR. What you want to see from complete blood count with ESR? What are the key points that will lead you to reach your diagnosis initially? A patient having carcinoma stomach, what will be his blood picture? Reduced hemoglobin, very good. Then you have to say ESR is raised. In malignant conditions, ESR used to raised, it's about more than 60 to 100 or more. Okay. Then if the hemoglobin percentage is more than 10 milligram per dl, then you will say, I want to do an upper GI endoscopy with or without biopsy. Okay. And any other investigation you want to do that time along with the blood before endoscopy?
Ultrasonogram.
Very good. Ultrasonogram of
Whole abdomen.
whole abdomen. What are the findings you want to see?
Sir, if there is any metastasis or not, the size of the mass.
No. In ultrasonogram, you cannot see the size of the stomach lesion or mass.
So for metastasis.
Ultrasonogram, you have to see several things, like you have to see the condition of liver, whether there is any secondary metastatic lesion or space occupying lesion is seen in the liver or not. Then you have to see whether there is any ascites or ascitic fluid is present or not, and also any lymph adenopathy is present or not. In ultrasonogram, it is quite difficult to see the lesion in the stomach. Okay, that's why the confirmatory diagnosis in here is upper GI endoscopy. But in case of hepatobiliary system, like if you want to see the condition of gallbladder or pancreas or liver, then ultrasonogram is a gold standard. Later it is replaced by CT scan now. CT scan is more informative than ultrasonogram. Okay. So when you have asked about the investigations, you have to say all these things. But if you asked about the confirmatory investigation to reach the diagnosis, to confirm your diagnosis, then you can only say it is endoscopy or upper GI endoscopy of stomach and duodenum with biopsy. Any questions regarding this matter?
No, sir.
Okay. Now, I have asked about the science of inoperability. What do you mean by inoperability?
For surgery, indications of surgery.
No, it is not the indication of surgery. What do you mean by inoperability?
Sir, general condition, sir, খারাপ হবে।
Inoperability means you cannot do the operation. Okay, there are several terms like operability, resectability. Here you have asked the science of inoperability. It means there are certain clinical signs present in the patient of carcinoma stomach that will lead you whether you can go for operation or not. For the carcinoma stomach, signs of inoperability, there are several clinical signs will be present, like can you say the signs of inoperability for carcinoma stomach?
স্যার মেটাস্টাসিস করে ভার্কোস গ্ল্যান্ডে
There are several routes of metastasis in carcinoma stomach, like one is hematogenous and one is lymphatic. If there is Barkos gland, that is
Left
what is
supraclavicular.
Barkos?
Left supraclavicular.
Lymph node enlargement.
Mm.
Okay, you have to complete this one. There is enlargement
Distant peritoneum involvement.
Abdominal distension may present due to
Ascites.
ascites. Very good. And you have heard about Sister Joseph's nodule?
Yes, sir.
Okay, what is that?
So in umbilical lymph node.
In umbilicus, there is a nodule
Lymph node.
present. That is from peritoneal metastasis. Okay. And anything else on examination?
So can we say jaundice?
Yes, you can say, but that will not lead you to reach that it is inoperable or not, because for that you have to do investigations. But on examination, there is another point you have to say. Have you heard about Bloomer's shelf?
No, sir.
If a patient having carcinoma stomach, and if you do the digital rectal examination, there is a feeling of shelf-like projections within the rectum. That is due to the involvement of the peritoneum from the metastatic deposits of carcinoma stomach, and it will produce rectal shelf of Bloomer. Okay, you can see the pictures in Bailey Love about the rectal shelf of Bloomer in carcinoma stomach chapter. So that will be easy to understand for you. Now tell me about the investigation findings that will help you to reach that it is inoperable or not. Any investigation findings? If ultrasonogram showing there is multiple space occupying lesion or metastatic lesions in the liver, ultrasonogram will confirm about the ascites, and also there is any lymph adenopathy, that is aortic lymph adenopathy is present, so it will lead you to reach the diagnosis that these are the inoperable findings for carcinoma stomach. Okay, and another one is diagnostic laparoscopy. What is that? Diagnostic laparoscopy.
When we open the stomach to make a diagnosis, not to operate, or we may operate it.
We will do a laparoscopic procedure where it will be used only for the diagnosis of the disease. So, diagnostic laparoscopy will help you to know if there is any peritoneal seedling is present or not. This is the only investigation that will help you to confirm is there any peritoneal metastasis present or not. Okay?
Yes, sir.
Now, if it is carcinoma stomach, what could be the other probable diagnosis? That is, what are the differential diagnoses of this case for this patient?
So carcinoma of the head of the pancreas.
Okay, very good.
Carcinoma of the transverse colon.
Carcinoma of transverse colon. Okay.
Chronic gastric ulcer.
No. Here you have known from the question there is an epigastric mass. Is there any lesion or mass is present in gastric ulcer? What
Oh,
do you
sorry.
think? So it is quite uncertain about what you are saying. Okay.
Yes, sir.
So while saying these things, you have to understand that there is several key points in every questions. So don't utter anything unrelated or irrelevant to the question. And you got all the correct questions, so you have to be answer in the to the point, not like you uttering all the things of carcinoma stomach. You should not be, because if the question like this one is just asked in different way to you, like a 55 years old male presented with new dyspepsia and having anorexia and weight loss. On examination, there is only anemia is present. What could be the probable diagnosis? Sorry? আমি শুনতে পেলাম না আপনাকে, বলেন আবার।
Sir, bleeding peptic ulcer disease.
Bleeding peptic ulcer, there is no hematemesis. I have not said about melena. So why have you said it is bleeding peptic ulcer? There is a clue, that is new dyspepsia or early dyspepsia. Any patient having early or new dyspepsia after the age of 40 is a feature of carcinoma stomach. There is 5 presentations of carcinoma stomach. Do you know that? Have you heard that there is 5 presentations of carcinoma stomach? Anybody else?
No, sir.
This will be discussed clearly on the tutorial classes that will be taken later on. Today's tutorial class will be happened or after 1 p.m. Okay?
Yes.
Is it okay with you?
Yes, sir.
Is there any of this patient you want to do? Any other investigations you want to do? Can you say for this patient?
Stool for ocular blood.
No.
Barium meal.
Contrast,
Contrast
Double
barium meal.
costal.
double contrast,
Contrast
barium
barium meal.
male. What do you mean by double contrast?
Double contrast.
What do you mean by double contrast?
Sorry, dye plus
there will be oral contrast and IV contrast, okay? But here it will be oral contrast only, not IV contrast is given in here. So what is the other contrast? That is ear. During swallowing, some part of ear will be also ingested, and that will help to make a double shadow. Okay?
Yes, sir.
Any questions regarding this one? Any questions?
Sir, the one where we are swallowing oral contrast and also air, ওইটাকেও কি
Yes.
স্যার আমরা ডাবল কন্ট্রাস্টই বলবো তাহলে?
Yes. আমরা যখন নিচ্ছি তখন হচ্ছে ওরাল কন্ট্রাস্ট নিচ্ছি আর ইয়ার কন্ট্রাস্ট নিচ্ছি। কন্ট্রাস্ট means a water soluble dye, that is gastrographin is using now, not barium meal. You have to remember this one. Now we use gastrographin. For urinary system, which dye is used now? Can you also, which dye is used for urological investigations? You have heard about intravenous urogram? Have you heard?
Ji sir.
Okay. That is urographin we use. Okay. For barium enema, that is another contrast X-ray we do for lower GI. Okay. So these are the things that you have to remember. So today I start with the GIT class, and GIT lectures, rest one I will take. You have to see the other questions that is provided. I think we need not to discuss all the questions. If you think any chapter of GIT or any short of long case or short case need to discuss, short case will be discussed by me later on. Mainly long cases of GI tract, you can ask me. Just inform me a day before of the lecture, the Tuesday, and I will prepare the lectures for you only about the long case. And regarding the questions, I think Dr. Nafisa has already told me that she has completed these questions. Is she?
So these topics, they have been covered in lectures.
Only lectures?
জি স্যার।
No solving of the questions?
স্যার ওইভাবে কোশ্চেন সলভ করায় না, বাট ম্যাম ওইভাবে পড়াইছে, মানে সিনারিও বেসড করে ডিউরিং লেকচারস।
Okay. So regarding GIT, another class you will be taken on 6th May, but I will try to cover you if any questions or any topics you want to discuss, you can. And later today from 1 p.m. there will be short case classes will be taken. So hopefully we get a little bit more discussion on that time. Okay. Do you have the Norman Bros with you?
No sir.
Soft copy. I already mentioned you can download from internet or from our library. Try to get a soft copy or any sort of copy from Norman Bros, because I will start from those soft tissue swelling like sebaceous cyst, lipoma, neurofibroma today. So mainly discussed from those book. If you have that one, it will be easier to follow my lectures. Okay. সমস্যা হচ্ছে আপনি আপনাদের কাউকে দেখতেছেন না, সুতরাং আপনাদের চেহারা ইমপ্রেশন যদি না পাই তাহলে তো বোঝা যায় না আপনারা বুঝতেছেন কিনা ঠিক মতো।
সবাই স্যাড।
ভালো থাকেন, কিছু করার নেই, হয়তো হোপফুলি কিছুদিনের মধ্যে সব স্বাভাবিক হবে, তখন সুন্দর করে আমরা আবার ক্লাসটা শুরু করতে পারবো। আর এর মধ্যে যে ক্লাসগুলো আমরা নিচ্ছি বা স্যাররা নিচ্ছেন সেগুলো একটু ফলো করার চেষ্টা করেন, যাতে আসলে যদি পড়ার টাচে না থাকে তাহলে তো স্বাভাবিক ভুলে যাবেন জিনিসপত্রগুলো, এটা একদম স্বাভাবিক। আপনাদের কাছে যেই বই আছে এখন, যেটাই আপনারা ফলো করতে পারবেন, ট্রাই করেন সেগুলি ফলো করার। আমরা তো বিভিন্ন কোয়েশ্চেন সলভ করে দিয়ে যাচ্ছি। আপনাদের কাছে এই কোয়েশ্চেন্স গুলি হার্ড কপি সফট কপি যেটাই থাকবে, আপনারা ট্রাই করবেন যে কোয়েশ্চেনটা সলভ হয় সেটা যাতে কমপ্লিট করে ফেলতে পারেন আপনারা, ঠিক আছে?
জি স্যার।
আর রুটিন যেটা আছে রুটিন এটাই থাকবে, রুটিন চেঞ্জ করার কোনো ইচ্ছা আমার নাই, স্যারদেরও নাই, কারণ এটা অনেক সবার সাথে কথা বলে এই রুটিনটা তৈরি করা হয়েছে আপনাদের। এর মধ্যে হয়তো দেখা যাবে যে ঈদের সময় একটা বড় একটা বন্ধ চলে আসবে, তো আমার মনে হয় না জুনের আগে আপনারা ব্যাক করতে পারবেন, মনে হয় না জুন জুলাইয়ের আগে না, যেহেতু গভর্নমেন্ট বলে দিয়েছে সেপ্টেম্বর পর্যন্ত সবকিছু বন্ধ রাখতে। মেডিকেল কলেজের ব্যাপারে কোনো সিদ্ধান্ত নেওয়া হবে কিনা এখনো কিছু বলা হয় নাই, ঠিক আছে?
জি স্যার।
আমার মনে হয় যে এটা মনে হয় হয়তো আপনাদের এরকম দেরি হবে, অগস্ট, জুন জুলাই আগস্ট হয়তো আপনাদের এরকম ভাবে ক্লাস করতে হতে পারে। যদি শুরু করা যায় সেটা তো আপনাদের জন্য ভালো হবে।